Over the last 4 months, we've seen a rapid adoption of telehealth by both providers and patients across the country in response to the COVID-19 pandemic. Telehealth is regulated by a patchwork of state and federal laws and regulations that cover a wide range of issues. Therefore, we've seen a variety of actions taken at both the federal and state levels to loosen some of the restrictions that were in place before the pandemic began and encourage access to telehealth services during this time. Now that telehealth is being used more widely than it ever was before, the question has become, what happens next once the pandemic ends? Most of the changes that we've seen so far are tied to the public health emergency and therefore will end when the pandemic ends. However, we've already seen movement at both the federal and state levels to make some of these changes permanent. For example, at the federal level, CMS Administrator Seema Verma has publicly expressed support for making permanent some of the waivers that have been adopted to loosen restrictions on Medicare reimbursement for telehealth services. The Senate Help Committee also recently had a hearing on telehealth, and many members expressed similar support for removing some of the restrictions on Medicare reimbursement for telehealth. At the state level, we've actually already seen some states take action to make changes permanent. For example, Colorado recently passed legislation that was based on an emergency order initially adopted after the pandemic began to remove some restrictions on telehealth reimbursement by private payers and the state Medicaid program. The legislation is modeled on that emergency order and therefore makes the policies in it permanent after the pandemic ends. In addition, the Massachusetts Medical Board, which had previously never adopted any formal guidance or regulations on the practice of telehealth in the state, adopted an interim policy when the pandemic began that expressly allowed the practice of telehealth without a prior in-person exam. The medical board recently took action to make that policy permanent, therefore lasting after the pandemic ends. We'll continue to watch which changes become permanent and which changes may revert back after the pandemic ends.